the chairman and the board of KMTC, the CEO and the leadership and management of KMTC, distinguished delegates, good morning. It is a great honor for me to officially open the 8th Kenya Medical Training College Scientific Conference. And I wish to particularly acknowledge the leadership. My two PSS are busy on other national duty, but I want to acknowledge the chairman, Mr. Cheriot, the CEO, Dr. Kelly, and Professor Kemayo for their leadership, and the team that put together this scientific conference. And I am very happy, majority, 90% are women, and that's why it's very successful. And to the students, faculty, partners, and online participants, and our guests, as I see you, I value you, and I thank you for being part of this very critical moment. As a Cabinet Secretary for Health, and as a member of the KMTC fraternity, I feel right at home. KMTC has been the engine room of the Kenyan frontline health care workforce. Its products, our nurses, our clinical officers, our lab technologists, and public health officers are not just practitioners. You are part of the backbone of our health system. You are the ones who bring universal health care coverage to life. This conference speaks to the heartbeat of our reforms that is taking place in our country within the parameter of the healthcare. The theme, advancing health equity in a rapidly changing environment, is not just an aspirational. It is the very grounded, the very ground we stand on. Our health sector is undergoing a one-in-a-generational transformation under President William Ruto's bottom-up economic transformation agenda. Universal health coverage is no longer a dream. It's a plan. It is funded by government, and it's already being implemented. And for your information, yesterday at 10 p.m., we recorded the highest number of Kenyans who registered with the Social Health Authority for the first time. And the number was 74,000. 74,000 Kenyans registered. Majority of them are now ready to access our primary health care facilities, level 2 to level 4. All they need to, both public, private, and faith-based. All they need to do is to register, they walk in, they are received, they are treated, they are given drugs, and they walk out. So KMTC is not just along for the ride. It is steering the wheel from assisting in training over 107,000 community health promoters to anchoring primary healthcare services in all our 47 counties. KMTC remains central to the delivery of our healthcare dream. It's the central to the delivery of our affordable, accessible, and dignified care to every Kenyan, regardless of their income or location. I have had a very candid conversation with the college leadership on the challenges you face, particularly on student financing. And I want to assure you that we are actively engaging with the National Treasury to unlock the 500 billion through the help to support the KMTC students. If I leave here today, I will not give time to my brother, the Minister for Finance. And the Minister for Finance has a very good relationship with me, because at one time he was the minority leader and I was the majority leader. God is great. We found ourselves in government. So we have a very good chemistry. And I'll tell him to release the 500 million, which is in the budget for our students to access. We are working with the Ministry of Education to ensure that KMTC is treated equally within the universities and TVET institutions when it comes to help access. No KMTC student will be left behind. And I've already made a written communication to my colleague, the Minister for Education. In our country, there will be equity, regardless of where you come from, regardless of your religion, and regardless of the community you belong to. Even as we work to open up financing opportunities, I want to challenge KMTC to be innovative. You must think beyond government capitation. You must explore aluminum endowments, philanthropic partnership, and you must blend financing models. If you want to remain at the top, you must also lead in sustainability. Let me speak frankly about the growing concern, the unchecked expansion of health-related courses in this country. And I want the principals who are here to listen to me. Some institutions are churning out graduates with a little regard for quality, relevance, or employment pathways. And I want to be very clear today that the Ministry of Health will not sit back and watch KMTC become part of this problem. KMTC will not offer credentials without competence. And I'm putting training institutions, particularly in the health sector, and our regulators on notice. Every course must meet a really public health need in our country. Public health need is critical. Every graduate must be ready to serve in our country. This college must continue to set the golden standard, not just in numbers, but in quality. That means rigorous curriculum review, strict admission criteria, monitored clinical rotations, and outcome-driven teaching. You are the national benchmark, KMTC, and you must stay there. Everybody else, you are 98 years old, so you must stay there, and you must be the national benchmark for the others to follow you. Research must drive our progress. In a world of pandemics, the NCDs, the digital disruptions, and the climate-linked disease outbreaks, we cannot afford to operate on a guesswork. Let me be very clear. In our ministry, policy must be backed by data. I applaud and appreciate KMTC for integrating research into its DNA. And I encourage every student and faculty member here to see research not as a thesis requirement, but as a public health obligation. I am particularly encouraged by the range of topics on your agenda: competence-based education, artificial insemination, AI, and digital health, climate and disease, healthcare financing, and NCDs. These are not just academic luxuries. They are Kenyans' real-world priorities. Push the boundaries, question everything, and come out with the practical, implementable recommendations that we can plug in straight into the policy pipeline. I look forward to receiving a formal brief of your outcomes at the end of this conference. Let me assure you, your ideas won't gather dust on our shelf. We are building a government that listens to evidence and acts on it. Your voice matters. In closing, let me remind you that science without action is charity. Let this not be a conference of very good speeches and great PowerPoints. Let it be a turning point. Let it be called to action. KMTC must continue to produce not just graduates, but guardians of public health. You must produce very good caregivers and compassionate people. And that is the legacy we must protect as KMTC. One of the things that the leadership, the board, and the management told me about is the clinical services, the rotations, which our students are charged when they visit public hospitals. That will never happen, particularly I will start with the level 6 that are under my ministry. Kenyatta Hospital, Kenyatta University Teaching and Referral Hospital, Mathare National Research Hospital, MTRH, and the professor is here. You better take them that message. The spinal injury. I have told the DGA and the SA, when we go back, we will communicate to them. They will stop that. And because this evening we are meeting the Council of Governors with the President, I'll whisper the President to pass the message to the governors. Even we looked at the list, even the payments are not harmonized. One is charging 10,000, one is charging, my county is charging Garissa 1,000. Another one is charging 2,000. You know, there's a problem in our country. Even if there was charging, there should be a standard. There must be evidence. There must be, you know, a very good reason. But Kenyatta Hospital here, where I was yesterday, is charging 10,000. And I thought, the students are coming to help you. It's like the entitlements. So because health is devolved, I'll consult with the Council of Governors. But for my level 6, I think the powers I have. Yeah. The powers I have. And we must bring, I want you to help me. We must bring trust, hope, and order to the health sector. That is what I want to do. I have no other business. And I want to thank the leadership. When I walked in, I remembered when I was a minister for defense for 2 years, the best places for you to visit, which are neat and clean, are our military barracks. So when I walked in, I said, have I come to DOD? Thank you, Chairman, Board, and the CEO. You know, well-taken grass, clean pavements, and that is the first impression you get, that there's a leadership, there's a good leadership in that place. Can we clap for Dr. Kelly and his team? And finally, let me talk about UHC, Universal Health Coverage. Universal Health Coverage, I have been around. I had the opportunity to serve with the late President Kibaki when he was the MP for Odaya. With great leaders, very, very good leaders, I had the opportunity. He tried universal health coverage. The Honorable Charity Ngilu was the Minister for Health. And there was a bill called Ngilu Bill. And Parliament, then I was a member of Parliament, we passed it. But President Kibaki refused to sign. Not bad, he was a good man. He said, how are we going to finance universal health care? And the Minister for Finance was David Miraria, so the bill could not pass the cabinet. President Uhuru came and tried his best and started with the 4 counties, Kisumu, Nyeri, Siolo, and Machakos. And sometimes in 2017, he called a meeting where I was and he said, this thing can't work. He dropped the ball. Then comes the hustler, President Ruto. And you know, in leadership, and I tell DG and the colleagues in Ministry of Health, until this morning, I was telling the DG this morning, on a DG, my business in this ministry from morning to evening is to bring solution and solve problems. So tell your people not to take me back. We must move forward. In leadership, you must make the right decision, not popular decisions. Before the 74,000, 23 million Kenyans have registered for SHA. The former NHIF had only 9 million. Only 20% of the population, which were salaried people only. The other 80% of our population had no insurance cover. Either they were being helped through fundraising, WhatsApp fundraising, or majority were dying at home because they could not finance. In 2023 alone, out-of-pocket health finance, the country spent 153 billion shillings. Today, God is great. A Kenyan can walk to any of our level 2 to level 4 as long as he is registered, and he will be treated. And we have increased the funding for KEMSA to increase their refill rate to 100%, so that in the most remote parts of our country, the health centers have drugs. And KEMSA will not be paid by anybody. They will be paid by SHA, Social Health Authority. We have brought a digital system where we can know from the facility who is treating. If a surgery is done, we will know that doctor. Without his pre-authorization code, that surgery will not be paid. So the system, we are getting rid out of ghost facilities, ghost healthcare workers, and fake and counterfeit drugs. Because even in the system, we have track and trace.